I work for the hospitals, I work for the medical, the healthcare sector. And during in the gated community that I live, almost all the elders, because I was the only medical professional in that gated community and I was traveling out of the center, out of the home, everybody else was dependent. The elderly who were staying alone were dependent on whatever support they needed, whether it is medicines, it was a diaper, it could be something else. So if we don't step up, there is no possibility that the elderly person living alone in that house, irrespective of social status, financial capacity, is going to be able to avail a service. So I think it is necessary for each one of us to step up and be the solution, build a set of solutions that will meet the needs of this group.
One question from Mr. Gauri Pati, where can we get a list of elderly care centers?
So there is a elder helpline by 14567. They will have the entire list of all the homes. And we can also provide, there is a lady by name Mrs. Nagachandrika. She's the president of all the old age homes in Hyderabad. I can get the list from her also if somebody is needing it. That's not an issue.
Okay. The next question is...
Ma'am, could you please repeat the number once again?
14567, Elder Helpline.
Oh.
Previously it was called Tata Helpline, now it's Elder Helpline. Senior Citizen Helpline.
With the kind of elderly care that is required now and the funds that people should keep aside for their own care, how much funds should be kept aside? How do you advise them to manage their finances? How do you advise them to handle their bills?
So that's a great question actually. So it all again boils down to whether a person is a pension holder or not. So if he's a pension holder, then probably we should look for a place or look for the comforts that can be accommodated in the money that he gets. Look, elder care can be from just a home based care to a very expensive, very, very professional institutionalization care can also be there. So when you see that large, wide bracket, depending upon that, we have to decide. The other things we need to consider are, say for example, nowadays the dependency on the diapers is very much you can see that people are depending more and more on diapers. So if you take the cost of the diapers per month, it's quite high. So I suggest that with a minimal, like a middle class person to have access to a quality elder care for himself, then probably he should aim at something between 25 to 35,000 per month.
Is this along with the net or without the net?
It's all without the attendant.
So the cost for 25% is without an attendant.
Without attendant. Attendant, again, there are different categories of attendants. Just a bedside attendant, then around 25,000 per month it is. Right from 22 to 25 is the bracket. If you are looking for a nursing assistant or a person who will assist you in a nursing, for nursing care, then it is anywhere between 50 to 1 lakh per month.
Wow.
Yeah, this is a very lucrative area for people to start a business actually. To tell you very frankly, that's how it is viewed at. Elder care is an area of business where people can make a lot of money because of the fragmented family structure that we have, and also the dependency on the different items that we got used to. So sometimes it makes me wonder what happened to all the elders who were our grandparents and all. They were never diaper dependent. So these sort of issues, because of all these dependency factors, also the cost of maintaining an elder also has shot up, and in turn it has turned into a burden for the family. So yeah, we need to be with a minimum comfort, with good quality of life, with dependency factors keeping them at minimum level, then you should prepare for anywhere between 25 to 35. Because we keep referring patients or the spouse who's left behind after he loses his wife or husband to cancer, we refer them to different old age homes. When we suggest old age homes, we get to hear the price ranges and things like that.
Ma'am, with the parents now writing out the wills and moving the properties into the children's name, how does it work? Do you advise something elderly people?
So I am also a senior citizen. Yeah, I can answer it from that angle first. Never ever do it. Never ever do it just because you want to get rid of these mundane things or the worldly things. Detach yourself and enjoy your life without all those hassles. Don't do it. Be prepared. Probably have it written somewhere and store it away, stack it away. But don't ever hand it over to children before you leave. That's my sincere advice, because in many cases we have seen wherein the thought of this money, the thought of this comfort, the comfort the money can bring has changed many people's minds, many children's minds, and the quality of the elder care was compromised. So, but there are ways where you can write a will in such a way that yes, he can have the access to the property in a way that he cannot sell it, but enjoy the returns from it and things like that. But never hand it over to the kids before our time. Never do that. It's my sincere advice. Even professionally speaking, if you ask me how do you advise if somebody comes for counseling to me as what should be done and things like that, even then I would say that write a will, be prepared for it, but put in a clause that they don't have any authority to sell it as long as you're there. That's what I advise.
So much of social pressure on the elderly parents. You don't know how to walk, you don't know how to manage, you can't take care of yourself, you move your house to your son's name, otherwise they'll go live separately, you'll have no one to take care of you. How do you handle that?
It's completely like, the voice is not there. Can you repeat the question? I'm sorry, I'm using that sentence.
There is so much of pressure, society saying you are old, you're right now dependent, you're unable to manage yourself and your finances and your day-to-day concerns. So leave everything to your son and move things to your son's name because you can't handle it, and then they will leave you if you don't move it onto their names. How do you advise them to handle this?
Yes, there will be some sort of a domestic pressure and things like that. There might be so many emotional components, so much of guilt trips, probably. All these things will happen. But I will tell one thing. If there are hereditary properties, probably we have no say in it except to pass it on to the next generation. But if the properties are earned by you, you have a lot of say in it. And there are lawyers and professionals who will guide you as how to keep that to yourself, to take care of your needs and take care of your healthcare needs and other elder care needs, and then later pass it on to the child. You can have a very professional outlook at it instead of having an emotional angle to it. There is always an emotional angle to this. I understand that. But you should also have a professional outlook towards it. Never work in these sort of issues. Never take decisions from your heart. Think logically, think practically, and take care of it. Because most of the times we don't save the money in the form of liquid cash because it doesn't give us much returns. We invest all our life savings in a fixture, like in a property, in a house, or things like that. So when we are saving it, actually we are saving it for the rainy day, for ourselves. That is what it should be for. We have spent enough time and enough resources educating our children, taking care of the children, and seeing that they're settled. So now the time is that if you don't want to burden them with your issues, with your medical issues or with your financial issues, then ensure for sure you have to ensure that you have that control over your own properties till such time that you decide when it should be. So a third party can be involved in it, like a lawyer. There are certain organizations which help the people when a message goes to that organization that so-and-so person has passed away, that person from that organization will come and meet the family and disclose the will that the person has written. There are certain facilities like that. Even in Hyderabad, I have heard that.
I'll get on to the next question from Mr. Nagendra Kumar. Whether doctors having specializations to treat elderly people are required, please send details of welfare schemes for elderly people. Is there a specialization for geriatric center?
Yes, there is.
There is, and there is. I would ask my colleague, Mr. Shashidhar Garu, to take this question.
Hello.
Was there?
Yeah, so I think the question was pertaining to whether there is a specialization for elder-related medical support, right? So there is a specialization known as geriatric medicine, and it's offered by universities, health universities, and there are practitioners. In Hyderabad, there are a handful of medical practitioners who address specifically geriatric issues.
Okay. Our next question is from Mr. JG. What is hospital center? What do they do?
So I don't. So this question has nothing to do with this topic, I think, but I can still answer that. So hospice center is a place wherein a person whose disease cannot be cured. A person whose disease cannot be cured is called terminal patient. Those patients are taken care in the sense that the impact of the disease on their body, the impact of the disease on their emotional, their mental level and mental well-being, and their social structure and spiritual structure. So a place wherein a multidisciplinary team works to ensure that what is offered for a terminally ill patient.
Next question is Dr. Bharati Tejas. What's your take on old age homes?
What's my personal take on old age homes? Yeah. So if it is taken, like if somebody prefers to stay in an old age home by choice, if they take a decision to stay there by choice, then whatever it comes with is accepted easily, right? It's not going to be your home like the way we vision it or we plan for it for ourselves, or we have got used into in the younger days of our life. It might not be like that. If it is by choice, but people do get adjusted to it. But if it is by compulsion, where the children of the household, or because they have no children, they are forced to stay in an old age home, then there are different issues. So my take is that the people, when we reach an age where we know that we are going to be dependent on somebody, even for our physical needs or activities of daily living, it should be our choice as how we want to live. So before somebody decides for us, I think we should decide for ourselves. Living or going to an old age home it's not a socially unaccepted thing nowadays. People choose like under different names like old age homes or retirement homes and things like that. Yes. So my take is that people should start probably owning it. That's my take. Or if you want to add anything to it,
Yes.
sir? Once again.
So about aged care centers, more from the services availability in India and the acceptance of it. One is what started decades back as a part of social service. Today, there are a lot of entrants into this space that are offering very good facilities at a charge, and therefore, for an aging population, as Sharda Garu had just mentioned, there is a choice today that you can avail a reasonably good quality facility that offers comfort, security, and also access to certain specific needs of an aging population, like for example, access to medical care, nursing care, or any other equipments that might be needed for this individual. Those things are being provided, but there is a gap. The gap is there is no middle layer in terms of affordability. I think the cost and the related expenses of good quality aged care facilities in India and even in Hyderabad, there are only two extremes. One which has almost nothing, which delivers very low level services, very basic services compared to what the individual needs, and those services are offered at much higher cost. So I think two things here. Decision should be owned by the individual, whether they wish to go to an aged care facility and what kind of aged care facility. The second is, very importantly, is the elderly, the older population, I think, has to now start investing their money that they have saved over decades in their own well-being in the last stages, rather than to expect someone to be able to do that for them, especially when it comes to family. There are a lot of reasons, nothing to negate someone, but I think given the fact that we are living in a more and more urban nuclear setup, it's essential that the elders invest in their own well-being. And I think aged care centers is one place which is going to be the future. It's going to be where a lot of the elderly population is going to be living in the next few decades. So this is my take.
There's a question from Dr. Bharati Tejas. Will you please unmute yourself, please?
Yeah, ma'am, just like what you said now, it would be the individual take. But then there are some, like the elderly, who they stay by themselves at home and they have their children who have settled across. But then still they say that, I know I am fine, we can manage ourselves in our own home. We don't need anybody to come and take care. Even if the kids insist like need to have some nursing people or somebody, no, we can manage ourselves. It's fine for us. So how do you bring them to an understanding that over a period of time their physical ability would come down, or whatever it is, they would need a dependency or a support, may it be a nursing at the home or may it be a old age home? So how do you get them convinced for such reasons, such situations?
Interesting question, because this is something we deal with quite often. So there are two things you have to understand, Dr. Tejas. One, you come from a generation that is relatively independent. You come from a generation that, even that includes me, that we tend to look at practically what needs to be done. Now, the generation of the elders, Gen X or the ones prior to them, these are individuals who have lived in a very community kind of a setup. Their social fabric is much more stronger. Their expectations are very different from what we are willing to offer now. There is a mismatch in expectations versus what they're getting. So when we work with the older population, one of the things that we encourage them to do is to explore opportunities and ways and means by which they can reduce their own distress or issues, find mechanisms of creating support systems at their level. At the end of the day, they may not be necessarily aware of what is available locally. It is for us to be able to create that set of information, tools that are necessary for them to avail. And I think this is where, when we work with an older population, we tell them that these are the homes that are available, these are the standards of these homes, these are the services that are available to you, this is a legal advisor who will help you plan your finances better, this is a person who can help you prepare your living will if you wish. I think there is a need for information and training of the older population as well. It's easier said when you give them that information and you say, okay, this is what you need to take a decision on. But that is a generation that's going to really be wary of anything that needs to be done, which is outside of their own life experiences. They're definitely going to expect a lot more, and it is our mountain responsibility to ensure that they get that information in a way that they understand. We need to spend time with that population. No decision is made promptly. It takes time. And therefore, working with an older population and getting them to accept all these services, it's not a one-day event. It's going to be probably a few weeks, if not a few months, before they accept it. Acceptance is something that is very important.
There's one question from Vijay Lakshmi. How can Wishwa help us? See, the only way Wishwa can help us is to bring social awareness. As Dr. Shashidhar said, our elderly today have lived in different times, and the expectation is very different because they have taken care of their parents in a different way and they expect it out of their children. But today, we are living in nuclear families. It's unfair to put the burden on a single mother or a single child or a single man, both financially and physically, to ask a youngster to work, to take care of the home, to take care of the children, to deal with the different stresses of today's life. We as elderly should, as Dr. Sarda said, understand the changing times, go see what are the old age homes around us, see what are the different prospects for elderly. Maybe all of the elderly can get together into a gated community which is closer to a hospital care or a geriatric care. The elderly have a responsibility as much as the youngsters do. And this is an awareness which, as Dr. Shashidhar said, it will take time for the elderly to understand. Does it mean the youngsters should not take responsibility? No. Does it mean that the youngsters should put pressure on the parents to move their finances? No. Our youngsters should understand that if the parents have any finances, the first responsibility for the finances is to take care of their health, and until their spouses live, the finances should be set aside for them. Number one, this is the responsibility of the children. The children also need to set aside time for their parents, to spend time with them, to talk to them. I understand all of us are busy these days. Even to set aside an hour for our own children is difficult. How do we set aside time for the elderly? But that is the compassion, that is the responsibility, that is the value system that we as humans, especially in India, need to reset and understand with the changing times that yes, youngsters have a responsibility and this is the responsibility. And as Dr. Sarda said and Dr. Konda said, it's not just about our own parents, but the other elderly people in our community also. We need to take time and we need to build that culture, especially with Indian joint family systems disintegrating. We do need to rebuild the culture in India in this aspect. So both elderly and the youngsters have a responsibility. This is what Wishwa is trying to bring across through various talks. This is why we've had this talk, because this is a need of the hour, and somewhere we need to redefine the value systems between the elderly and the youngsters. Sir, Dr. Sarath, would you like to add something to this?
I think you covered what I was thinking. In fact, very well articulated. But I definitely think that this ongoing dialogue between generations is an absolute necessity. And if we don't, as I'm a Gen X, and there is a Gen Y ahead of me, and there is behind me my parental generation, three different people, and the Gen X is the one we are the transition generation. And I think the challenge for us is to not only build a better future for tomorrow, for the youngsters of tomorrow, but also work towards building a society. And this is where not only is training and awareness, but I think as a generation, we need to be a lot more open to exploring opportunities, creating opportunities. In fact, one of the things that comes to me is when someone in the earlier question said, in Chennai, there is a certain issue, for example. Technology is not the solution for everything. To put a WhatsApp group and expect all the elders to be on WhatsApp group talk, that isn't necessarily their way of community. So there is an opportunity for individuals to step in and provide services. When companionship was brought up as a point earlier, companionship does not happen because we as individuals are so busy. How much of time in a week and go spend some time with a person we don't know much about? It has to be intrinsic. It has to be something that we want to do ourselves. So there is a youngster in Bombay who I believe he is guided by Tata to put up a companionship program. We may not necessarily have to do something at that scale, but yes, as individuals, we'd like to volunteer our time. Let us create mechanisms of engaging with that generation. Once you do that, then I think a lot of these other issues, like where they're going to stay, who's going to care for them, what kind of support systems are available, all of that can be addressed. And I'll just give you an example. During COVID, I work for the hospitals, I work for the medical, the healthcare sector. And during in the gated community that I live, almost all the elders, because I was the only medical professional in that gated community and I was traveling out of the center, out of the home, everybody else was dependent. The elderly who was staying alone were dependent on whatever support they needed. Whether it is medicines, it was a diaper, it could be something else. So if we don't step up, there is no possibility that the elderly person living alone in that house, irrespective of social status, financial capacity, is going to be able to avail a service. So I think it is necessary for each one of us to step up and be the solution, build a set of solutions that will meet the needs of this group. So whether it is identifying an old age home in your area, visiting it, even if you have no use for it, but if you're able to review it, you're able to do an evaluation and put it out into the general community, into the public forum, and say that this institute has this services. This is what I think is what is good about it and what is not good about it. You have created a mechanism for someone to evaluate local resources and take probably an informed decision about putting their elderly or their loved one there, or where an elderly person might be thinking, I cannot manage the house anymore. I want an old age home to shift to. Their biggest dilemma is they don't know where. I remember a neighbor of mine, a retired Air Force test pilot, who's alone. He's a widower. And he's asking me this question, Shashi, I don't know where to go. I don't know what to do. I don't know who's going to care for me. He has stage 4 cancer. Who's going to care for me? So unless we as a community step up, unless we become stakeholders in the care of the elderly, how is it possible that some solution is going to work for them? That some solution probably is inaccessible to them because they're not tech friendly. It's probably inaccessible to them because they're not aware of it. It's probably inaccessible because nobody's talking to them about it. It's probably inaccessible because they're alone in a small little world in which there is no other light that falls. So isn't it our responsibility to be a part of that solution? That is what I personally feel. I think we all need to be a part of that solution. Let's step up. That's my request.